When should I worry about diverticulitis perforation pain? Imagine feeling a dull ache in your lower belly that gradually worsens. That's often how diverticulitis starts, with small pouches in your colon called diverticula becoming inflamed. Most cases are manageable with medication and diet changes, but sometimes things can take a serious turn. Perforation happens when one of these inflamed pouches bursts, letting intestinal contents spill into your abdominal cavity. This is a medical emergency and needs immediate attention. The typical diverticulitis pain is usually in the lower left side of your abdomen. It's often constant and can range from moderate to severe. Along with pain, you might notice fever, nausea, vomiting, or changes in your bowel habits like constipation or diarrhea. These symptoms can come on suddenly or develop over a few days, depending on whether it's an initial episode or a recurring one. Now, how do you know if it's more than just regular diverticulitis? Certain signs should make you seek urgent medical help. If your pain suddenly becomes much worse or spreads across your abdomen, especially if your stomach feels rigid or tense like a board, that could mean a perforation. High fever and chills are also warning signs of a serious infection, which is more likely if a rupture has occurred. If you feel faint, dizzy, or your heartbeat races, these could be signs of shock, indicating the infection is affecting your whole body. Persistent vomiting or an inability to keep fluids down is another red flag. If your stool shows blood or mucus, it's important to get evaluated, even though these are less common. Also, if your symptoms don't improve with initial treatment or come back quickly after seeming better, it could mean a complication like perforation. Perforation is dangerous because it can lead to peritonitis, which is an infection of the lining of your abdomen. It can also cause abscesses or sepsis, a life-threatening response to infection. These complications can develop fast and often requiring hospitalization. Treatment usually involves antibiotics and sometimes surgery to repair the rupture and clean out the infection. If you experience any of these warning signs, especially severe or worsening pain, high fever, signs of shock, or inability to keep fluids down, seek emergency care immediately. Doctors will diagnose perforation with physical exams, blood tests, and imaging like a CT scan. Treatment depends on how serious the perforation is but often includes hospitalization, antibiotics, and possibly surgery. Living with diverticular disease means staying alert to your symptoms. Knowing when pain is just normal or when it signals something more serious can make all the difference. Always follow your healthcare provider's advice and report any new or worsening symptoms promptly. Remember, early diagnosis and treatment of perforation can prevent life-threatening complications. So if your pain suddenly intensifies, spreads, or is paired with fever or other concerning signs, don't wait. Get medical help right away.